Concordia. Taoiseach, Health Minister Riley has bypassed any meaningful democratic scrutiny of the HSE service plan by the Oireachtas by delaying its publication until the last sitting week of the year. And as you know, details of this plan were leaked before the Dáil had sight of it and before it can be discussed by the Health Committee. And all the spin, that health cuts, including cuts to medical cards, will be less than previously signalled. That doesn't impress anyone, Taoiseach. Can I draw your attention to the case of Mirren Lacey? She's a 4-year-old girl from Donabate. She's fighting stage 4 neuroblastoma, which is a very rare form of children's cancer, and she's currently undergoing chemotherapy. Yesterday, she had her application for a medical card rejected. Then there's the case of Kate McShane, who I have talked to you about before. She's Down syndrome. She needs long-term medical care. She's still being denied a medical card. And what then, Taoiseach, of those profoundly deaf children awaiting bilateral cochlear implants? I welcome cautiously the fact that £3.2 million has been allocated to them, but that's actually less than what is required. So, Taoiseach, would you accept that the only valid test, whenever we get round to discussing it, of the HSE service plan will be if it results in those citizens, lesions, getting treatment and the service that they're entitled to? And that, Taoiseach, is their right. So could you assure parents of seriously ill children and every other sick citizen that the HSE service plan will mean that they will get the treatment they deserve?
Thank you. Taoiseach.
Well, I explained this process to you before, Deputy Adams. The budget takes place, votes go through in respect of the ceilings for each department. The Health Service Executive prepare its draft report based on those figures and submit it to the Minister for Health. The Minister for Health examines the draft proposition and recommends changes or amendments to that, and either signs off on it or doesn't. The Minister took very careful consideration of the draft report by the HSE and made recommendations for changes to that. And following the report being amended, the Minister approved the service plan for 2014. Now, the question of the 113 million that was allocated in respect of a probity issue about medical cards is one of serious importance for people around the country. The situation was that when that was included in the budgetary figures in the first instance, it was subject to a process of examination. And the Minister for Health examined this in accordance with his duty, both from within the department and the HSE, and found that a figure of 113 million savings in respect of medical cards was not achievable. And because of that, a change was brought about. Now, the situation, Deputy Adams, with that 47 million was available from the Department of Social Welfare because of the drop in the live register and savings within that department by Minister Burton. So the situation is that only 22 cards in the entire country were returned voluntarily. Because of a change of circumstances where somebody got a better job or their income increased. You have more medical cards now issued than ever before. And so the normal process of validation of eligibility will continue. I don't suppose you're expecting me to say that the Minister should have changed the eligibility criteria for medical cards, because he didn't do that. So there will be an ongoing process of review of medical cards, as has always applied. But the figure that was included in the original budget was not acceptable to the Minister, and so he changed it. I think that's a good thing.
Deputy Adams.
Taoiseach, first of all,
thanks very much. It's Deputy Adams' question.
Taoiseach, can I thank you for explaining to me once again how the HSE service plan is arrived at? I find that very instructive, and let me assure you, you don't have to explain it to me ever again. What you could perhaps do is answer the question I asked you, which was to give assurances, particularly to parents of seriously ill children, that this new service plan will make sure they get the services that they require. Now, it appears to me, and I've explained this to you before, that the Minister dreams up figures, cuts services, and then at the end of the year comes back with supplementary estimates of hundreds of millions. So, all of this begs the question of where did the Minister pull the original figures from in the first place? I think it goes without saying that any society, particularly a society which describes itself as a republic, should be judged on how it treats its most vulnerable citizens. And I make the case to you that these children and other sick citizens are among the most vulnerable. So, Taoiseach, I want to put the question to you again. Can you give an assurance that this plan, which I think is a blueprint for greatly reduced services, will give these citizens the services that they require? And do you agree that health cuts, whatever about the difference between the figures that were given, the fact is it's over €600 million in cuts. Do you agree that over €600 million in cuts will have utterly devastating consequences for these citizens and for our health services?
This will be a challenging year for health, no more than for any other department. I've made this perfectly clear. The fact that the country has thankfully exited the bailout programme doesn't mean that everything is rosy in the garden. And for you, as the leader of the department, as the party of the impossible, you're never going to be satisfied no matter how much is allocated to any particular sector. That's your job. Fair enough. I want to say this to you. The situation is that the health service plan for 2014 has been approved now by the Minister for Health. While this will be a challenging year, we expect that the Minister's philosophy of cutting costs but not frontline services will continue to be effective in the interest of patient outcome, which is the most important element of any health service. What are the outcomes? What are the opportunities for patients to have the best level of service as close to them as possible? Now, in this service initiative for 2014, there are a number of initiatives which are new and which are important. For instance, there's 1.48 million to deliver patient-centred improvements in maternity care. This was raised here. There's an extra €8.3 million for the cancer area. There's an extra 2.92 million for organ donation and transplantation services. I had discussions with some well-known people about the importance of this. There's 35 million has been provided for an additional 60,000 medical cards in 2014, Deputy Adams. There's 37 million provided for free GP services for children under 6. There's 14 million extra provided to address priority needs in disability areas, and 20 million has been ring-fenced for posts for mental health personnel in 2014. And there is the 3.2 million to commence the sequential and simultaneous bilateral cochlear implants, with particular focus on 5 to 6-year-olds, and that's an issue that you raised yourself, and quite rightly so. And so, when we don't have all of the money to do all of the things, these are key service initiatives which will take place in addition to effective delivery of frontline services for patients in 2014. So yes, it's challenging. Yes, it's challenging, no more than any other department, but it's also a commitment of government to continue to cut costs and not services.